Have you heard of the Healthy Campus concept? Well, it's big news in the unified government of Wyandotte County, and here to tell us all about it is the mayor and CEO, Mark Holland. We are coming to you from the Royals Hall of Fame. I'm Jill Jensen, and it is so great that you could be with us. And you too. Welcome.
Thank you. Glad to be here.
All right. Well, you are getting some positive reviews on social media, and it must be true then that this Healthy Campus is a great idea.
That's right. Well, it all started in two unrelated programs. Well, three really. In 2009, the Kansas Health Institute ranked Wyandotte County 105th out of 105 counties, and subsequent reviews have continued that trend. We took action, formed Healthy Communities Wyandotte in 2009, and have been working for 5 years in the areas of communication, education, healthy infrastructure, access to healthy food, and access to health care. And in response to that, we've worked a number of initiatives, but also we've been working on a downtown grocery store for the Northeast, a grocery store to serve the Northeast. It's a food desert, and we've reached out to a number of vendors and have found, as they looked at different sites around downtown, 10th and State looked like a really good location. In an unrelated story, the YMCA downtown in KCK is 100 years old. We're one of the few communities left that has a 100-year-old Y, and they've vetted a number of sites downtown to see where to build a new Y. Came to 10th and State. And as we were looking at that just last summer, we said, you know, this really has the makings of a healthy campus, particularly in light of the Kansas Health Institute rankings. Being able to address healthy living choices with the Y, healthy food options with a grocery store, let's do even more. And so we've contracted with Gould Evans, the Reach Foundation, Greater Kansas City Health Foundation, and LISC have all contributed over $100,000 to do a master planning of this healthy campus to look at beyond those two areas, to also look at green space options, housing options, and other retail options that could go with it, and perhaps a medical partner as well.
Yeah. Well, let's go back and take a look at this vision. And one thing that I want to hone in on is a word that you used, a terminology that some people at home might be going, desert. What do you mean a food desert? I'll just get in my car and go down to the grocery store. But therein lies the problem.
That's right. Well, when we contracted with AWG, Associated Wholesale Grocers, which is a Kansas City, Kansas company, to do a study to look, and remarkably, when they did their study, they discovered that people in Wyandotte County buy groceries. And so they're just not buying them in Wyandotte County. They're driving across the river, north, south, or east to get their groceries. And so people are looking for that grocery store. And people who have a grocery store in their neighborhood take it for granted. But in the urban areas, and it's not just Kansas City, Kansas, it's urban areas across the country, the grocery stores have left the community. And to be able to reestablish those, and not just reestablish them with quick foods, but with healthy foods and healthy food options, and then to help educate people about healthy food options so they can make good choices for their family.
Which is also very important for Wyandotte County, because some of the numbers that are coming back in those areas with obesity, just the health of your kids, that there is a lot of belief that if you can just get healthy food close to them and in their hands, that you can change some of that.
That's exactly right. Of the 40-some criteria that the Kansas Health Institute used to rank the counties, the number one correlate, of course, is poverty. So areas that have the highest poverty ranking in the state also have the lowest health rankings. And so, not as an excuse, but as an explanation, if we can address some of those diseases that specifically target poorer people, and that is obesity, hypertension, diabetes, these are all preventable and addressable if you give people the tools, both the education and the access that they need in order to make better choices.
Right. 20 seconds left. If people want to help, how do they help?
Well, this is great. I mean, the Wyandotte Health Foundation just contributed $1 million to the community center. Anyone that wants to contribute $1 million is welcome to do that. But we have a great infrastructure through Healthy Communities Wyandotte. And if people want to get involved, they can contact the mayor's office. And they can also reach out to us on Facebook at Mark Holland on Facebook. And we can get them connected to a lot of the activities we're doing with the Healthy Campus and Healthy Communities Wyandotte.
All right. Thank you for being with us.
Thank you.